Hi, I'm Bob Spurgeon. Thanks for taking a few moments of your time to listen to this very, very important discussion we're going to have. The coronavirus pandemic has completely changed the way we work and live. Over the next few minutes, we're going to talk about how to manage the waste that's generated by the coronavirus and patients that are COVID-19 positive. And we're going to clear up a lot of the confusion that has surrounded this. I have been in private practice consulting on medical waste issues for 30 years, and I have been in the thick of this pandemic discussion on how best to manage it. So we're going to clear the air and make sure that you have the accurate information that you want. So if you are in the healthcare industry, if you are providing care to patients, if you're doing drive-up testing, if you're in the medical waste services business, you're a driver transporting it, you're a plant operator treating it, you're in the solid waste business at a landfill transfer station driving a roll-off truck, or you're providing products and services to the healthcare community associated with the coronavirus and COVID-19. This information is something that you very, very much need to hear. So first of all, let's clear up one very confusing point that has arisen and I've been asked repeatedly over the last several weeks. The coronavirus and COVID-19 are not what we consider a Category A infectious substance. What do I mean by that? Cat A substances are diseases that are highly virulent and highly communicable, and most often we associate a Cat A infectious substance with the Ebola virus. When we had the Ebola outbreak in the United States several years ago, policies and procedures for personal protective equipment, for packaging waste, for handling it and disposing of it were radically changed to accommodate the virulent aspects of this virus. In the case of the coronavirus and COVID-19, and this is a very important point I want you to understand, the waste associated that's generated in the coronavirus analysis, laboratory setting, or COVID-19 positive patient treatment is no different than the way you would handle regulated medical waste. So, if you are a healthcare worker, the PPE you use, the personal protective equipment, the gloves, the gowns, the masks, can all be put in a red bag with other disposable medical waste products. Syringes, needles, scalpels, pipettes, sharp objects, those can be put in a sharps container. And then the sharps container and the red bags can be placed in a regulated medical waste container for transport to a medical waste transfer station or appropriate treatment site for disposal. Waste associated with the coronavirus and COVID-19 can be effectively treated via autoclaving, incineration, pyrolysis, or another approved treatment method, such as chemical disinfection or microwaving or one of the other methods that are out there that have been approved by the respective state to treat and have been shown to be efficacious with regulated medical waste. So, we package it the same, we manage it the same, we transport it the same, your documentation stays the same, it's treated the same, and once it is effectively treated, it can be disposed of in a solid waste sanitary landfill or solid waste disposal site, as required by the appropriate local laws and regulations. Once you do that, all will be well. So, we need to understand that the policies and procedures and plans that are in place for regulated medical waste, you understand, you train your employees, and most importantly, you execute them appropriately. And all of the agencies, EPA, Department of Transportation, OSHA, Centers for Disease Control, state regulatory agencies, and health departments all agree that if you adhere to your policies and procedures for regulated medical waste, and you manage it according to those procedures, you will protect yourself, you'll protect your patients, your coworkers, and the public at large. So thanks for listening. I'm Bob Spurgeon. If you have any questions, if I can be of any help, reach out to me on Facebook, LinkedIn, my webpage, and I'm happy to answer your questions. Thanks for listening, and remember, compliance doesn't have to be difficult.